Hi, I'm Emma Mazzeo, and I am a junior nutrition major at UMass Amherst. In this video, we will be going over a research question I've been working on throughout the semester. My research question is, does vitamin B12 have an impact on our susceptibility to depression? Some background information on this is that depression is directly correlated to low levels of the serotonin hormone. B vitamins in general, and specifically vitamin B12, play a role in producing mood-affecting hormones like serotonin, hence why there could possibly be a link between vitamin B12 deficiency and depression. Vitamin B12 is an essential nutrient that is important in many bodily functions. It plays a key role in development, DNA synthesis, health of red blood cells, and the central nervous system. The RDA for vitamin B12 varies by age, but for females and males 14 and older, it is 2.4. Vitamin B12 is only naturally found in animal products, but it can also be found in fortified foods, and you can get it through supplementation. Some examples of specific foods would be beef, liver, chicken, fish, fortified breakfast cereals, and fortified nutritional yeast. Vegans and vegetarians are specifically at risk for vitamin B12 deficiency due to the fact they do not eat many or any animal products. Also, elderly people are at risk because as you age, your ability to digest and absorb this nutrient can decrease. Speak to your doctor about what your best option may be if you fall into these categories. Now, let's look at some studies together to see what has been found about the relationship between vitamin B12 and depression. Here I'll mention some studies I have found where the results showed a correlation between vitamin B12 and depression. In a study done by Sanchez-Villegas et al., they found that low levels of vitamin B12 was linked with depression, specifically in women, but not men. In another study done by Penix et al., they found that there was a twofold risk of depression in physically disabled older women with low levels of vitamin B12. Lastly, in a study done by Isnafoglu and Ozturan, they found that low levels of vitamin B12 may contribute to severity of depression in children and adolescents. Similarly, there have also been studies that found no relationship with low levels of vitamin B12 and depression. A study done at University of New South Wales in Australia found no correlation between depressive symptoms and vitamin B12 deficiency. In this study, their sample was middle-aged people living in a community setting. In a study from Bjelland et al., who sampled people from their late 40s and early 70s, also found no correlation with vitamin B12 levels and depression or anxiety. There is still much research that needs to be done on this topic in order to conclude that there is a real relationship between the two. Some studies have found a convincing relationship, but others have not, so there is no clear answer here. Regardless, vitamin B12 is still an important and essential nutrient that everyone should make sure they are getting enough of. If you consume animal products on a regular basis, then you most likely have sufficient levels of this vitamin. If you are vegan or vegetarian, you should try to eat fortified foods that contain vitamin B12, such as certain cereals or nutritional yeast. You can also consider supplementation. Older people should also consider supplementation due to ability to digest this nutrient. But of course, talk to your doctor if you have any questions or concerns. Bye, and thank you so much for watching my video.